This video is designed really to go along with the curriculum that you're learning at your college from your instructors. It's not to replace it. It's just to make you feel more comfortable with things that you may hear or see, encounter at your clinical rotations. We hope that you'll rotate through Union Health as a student, or maybe even work here in a few years when you graduate. Hint, hint. But even if not, you are welcome to still view these videos because it's more about the X-ray language versus all Union Health specifics. So it is designed to help you with what you're already learning. So let me get you started out. This is just a slow skate, the education slow skate, where we talk about things very briefly of how you've learned them and what it really means when you go to clinical. Something that you are definitely going to hear at clinical is about shielding and collimation. So I put them together because the principle kind of holds true for both standards. This little image that you see right here is an x-ray of a pelvis of a young child. So we see a lead shield used to block the x-rays. When we block x-rays, it's going to show up super white. And then when the x-rays don't have anything resisting them, there's nothing of a radio opaque material, we're going to see a dark, dark color over here. So this is actually just the air. This is the bone. And then this is the lead shield that we see. So it shows up super white. Collimation is also a way to reduce the amount of x-ray beam that touches our patient, so to speak. And I put them together because it works in a similar way. This lead shield is resting on the patient, but also in the x-ray tube itself, there are pieces of lead called a collimator. The collimator essentially comes together to kind of pinch that x-ray beam down to a certain size so that we aren't just exposing a large field when we only need a little bit. So both save radiation exposure, both work with the material of lead, but collimators live in the x-ray tube and shielding is placed on the patient. If your technologist tells you to collimate down, they just want you to inch that in so that we're not exposing as much of that patient, especially radiosensitive areas. So just to show you what that looks like, this is actually a video recording of one of our x-ray rooms here. This is that x-ray tube. That is our collimator light that I just pushed, and see how that light shows up on the floor. When I turn that one knob, it's going to collimate this way. When I turn that second knob, I'm going to collimate in this way. So the light, by the way, behaves a lot like x-ray. So that's why we use it for positioning, because we can actually see it versus x-rays. We know how those x-rays are going to behave with that collimation. So if your tech says collimate in, I mean turn those little knobs on the x-ray tube. Something else that you might hear your technologist say is the word Bucky, or the phrase line up your Bucky. So when we talk about Buckies, it all comes back to this guy. This is Gustav Bucky. By the way, he looks a little bit judgmental in this picture, but I'm sure he was very nice. He's telling you you forgot to line up your Bucky. He is the person that invented the way we have a grid in an x-ray tube, or in an x-ray table rather, or in a stand-up wall stand. So what your technologist is really referring to is that tray that moves, that contains the image receptor in the table or the actual wall stand itself. So we're talking about the area that is going to be exposed. We'll do another video that explains how grids work, why they work at another point, but they're really just saying line up your camera or your x-ray tube with the subject or the image receptor. So just to show you what that looks like, this is actually one of our rooms here at Union Health. Here is my x-ray tube. Of course, we can see my light is open. We also have a nice laser light that meets us right in the middle of the wall stand, sometimes called a wall Bucky, that contains an image receptor right in here. Now, here at Union Health, we leave those image receptors in some of those digital rooms, depending on which one we have, unless we need to take it out for some sort of on the cart work. So it's just living right in here. We line it up with that laser, and then in some rooms, they are taken out to charge. So it kind of depends on your site. Sometimes within the same site, it depends on the room that you're in. So in this case, we know that this is lined up. You can actually see a green light up here, and that is because our fancy room tells us that we are perfectly lined up. They're also talking about the detent that exists on the tube. So we're going to put our detent in so that it lines up right here to the wall stand. And we're also going to put a detent in, for example, for a chest x-ray at 72 inches for a source to image distance, an SID. How exactly does that x-ray tube get lined up? Well, this is how. The x-ray tube has a lot of buttons on it, and I'm going to show you which one does specific things. So here we see an angle button. That moves the x-ray tube so we can angle up or down. We could angle it to face the wall stand if we were doing a chest x-ray. Now we have a button that drops it up and down. We have a swag button that turns that x-ray tube side to side. We use that a lot for trauma exams. This button right here that you see me using is going to be used to push back to center over the table. And then also we're going to pull it forward to center in front of that wall stand. That green button I just pushed would be used to center maybe a 40 or 72 SID in front of that wall stand again. Again, demonstrating that angle there. And this is something that you're going to play with in lab, and then I suggest whatever clinical site you're at, you're always going to want to go in and play with the rooms. Don't worry about studying when you're at clinical. Worry about the rooms and get comfortable, because I guarantee you, you do not have an x-ray room at home. If you do, I'd like to know about it. But this is how you just kind of move it back and forth, let yourself make a mistake, let yourself go into detent, so that means it's centered right on the wall bucky. Let yourself fix it, and that's really going to be the way that you learn best. Again, I'm going to show you, back this up just a little bit so you can see what some of these buttons do. I don't suggest using this button right here that I have my hand on. That is an all release button, unless you just need to move the x-ray tube quickly. So if you're lining up that x-ray tube over your wall stand or table, then use the other buttons, at least until you get really comfortable. Because when you release all of the locks, it's a little bit of craziness, and it's hard to get one to stay while you're locking in another. Because, for example, at the wall bucky, you're trying to center two ways, and that can be a little bit difficult. So until you get really comfortable in the room, don't use this one just where it goes all willy-nilly all over the place. Use the buttons that are actually on the x-ray tube here until you get really comfortable with it. Another term or phrase defined is let's manual that technique. So what your technologist is really talking about is we are no longer going to photo time this image or use the AEC, the automatic exposure control. We are going to use our brains, and we are going to set our own technique. The reason that we do this is that AEC is great. It gets us a readout, but sometimes there are things that contribute to not the best contrast. So using that manual technique that your technologist has stored in their brain, and that eventually you will too, will ensure a really pretty image. Let's look at what that looks like on an actual control panel. So here we see it in the life. By the way, we have one of the fanciest control panels, I think, because this is a camera looking into the room. It's fantastic because you can see exactly what your x-ray tube sees as you're positioning the patient. So if you go back behind the panel and they move really quick, you can see it. It's a nice feature. But this right here is what we're talking about with the AEC portion. So you have all of these different controls, all of these little icons. We're at the wall Bucky, moving to the table. We have a patient size one. And then right here is that AEC. We can see that a little bit closer. We always start out with our exam, and that helps bring up the KVP that is appropriate for that exam type. You'll learn a lot about that with each exam. It differs with each body part. You can also change that patient side, like I mentioned, and even while you're using the AEC, you can adjust the KVP a little bit. Notice what happens when I turn that off, though. Now we can change both the KVP and the mass, including the MA or the seconds. So that's something that you'll learn about later. It'll also tell us if we have a grid or if we don't have a grid in. You're always going to want to use one at the wall stand for a chest x-ray. You'll learn about that. And the really nice thing about some equipment like this tube is it has the technique right there. You see 120 over 2, so that was our KVP over our mass. And it is lined up and ready to go with a green light. That is not typical for a chest x-ray. Most of the time we're going to use the AEC when we're in the room using the wall board, but it's nice to see how you do it, especially when you get out there and you start moving around with buttons. And most of the time when we have to change a technique, we have to do it pretty quickly. So again, that's something I suggest you do your first week of clinical is get into the room, play with it, see how you would adjust things like technique, switch from wall key or image receptor to table, and that'll help you really be able to move in the moment. So if you have any questions about that once you get out to your clinical site, make sure that you ask your clinical instructor, the technologists. We're always very happy to help. And even if we here at Union Health have to bring up a test patient and just have to shoot a couple of test images with a skeleton, that sometimes can really boost your confidence. So if you hear any terms or phrases, technology inspired words in your area when you're out in clinical and you don't know what they mean, feel free to ask your instructors, but send it my way too, and I'll include it in our next video.